Hello, everyone. Welcome to our first speaker series in our Social Change Career Speaker Series. I'm Thanera Bailey, President and CEO of the Sister Group, and our speaker series is a way to highlight the diversity of career opportunities in the social sector. And we're really excited to have Ernestine Walker with us, who is the Vice President of Community Health and Inclusion at the American Heart Association, to share with us her career journey. I'm joined by four of the interns in our program who we do the speaker series for, and we're excited to have those of you that have joined us in the audience. If you have any questions, feel free to type them in the chat. I will try to moderate as much as possible and ask those questions of Ernestine directly for you. Anything that we don't get to in this live conversation, you can feel free to watch the replay and enter your questions there, and we'll make sure we get them to Ernestine. But first, I'd like to start by having the individuals that have joined me, my colleagues that have joined me today, to just give a quick introduction, your name, your location, and what you're studying, so that Ernestine has a background and so does the audience. So who would like to go first?
I got it.
Go ahead, Mike.
Hi, I'm Mike Coulter, and I live in Aptos, California, which is just east of Santa Cruz. And my field of research is adolescent substance abuse.
Great. Who would like to go next? Genevieve?
I'm Genevieve Bixler. I live in New York City, but I'm currently in LA today. I am studying social work and business in a global society, and I'm very interested in sort of how social work and the business world go together, more macro social work.
Great. Shamika?
And my name is Shamika Noland, and I live in Texas, studying Master of Social Work at the University of Southern California. And I have an interest in racial inequality.
Great. And Carly? Appears like Carly might be frozen, but hopefully she'll be able to join us later. She also is an MSW student at the University of Southern California. So we're going to go ahead and start our conversation, Ernestine, by asking you to introduce us to Ernestine Walker.
Sure. So I am Ernestine Walker. I am the VP of Community Health and Inclusion at the American Heart Association, and I've been here about 3 years. It'll be 4 years in April.
Great. So when you think about your role in your work, what do you do? What is the VP of Community Health and Inclusion? What does that mean? What does that look like at the American Heart Association?
Sure. So I will start by saying I actually cover 5 states. So I work in Pennsylvania, Delaware, Kentucky, Ohio, and West Virginia. And my role at the American Heart Association really encompasses all things community. So if you're looking at the health of the community, say, for an example, in Philadelphia, what does that look like from the lens of all people within the community? And then I also oversee the multicultural arm, which really takes a look at of those people most adversely impacted by social determinants of health. How do we also make sure that we're providing programs that meet their needs? So my job overall is really looking at the community at large, and then as a part of that, really honing in on those communities that need us most.
And could you, for people who may not be that familiar with the American Heart Association, which I doubt, but just in case, could you just tell us a little bit about the work that the American Heart Association does, and then where does community health and inclusion sit within that work?
Sure. So I will start by saying the American Heart Association is really one of the largest nonprofit health organizations probably in the country. We're really doing some work overseas now. We are an amazing group. And I'm not just saying that because I work here. I'm saying that because it really is true. We are really looking at the health of all. So if you go into the airport and you see an AED, that is through the work of the American Heart Association. If you get your CPR training, hands-only CPR training, that is really, it lends itself to the research and the work that has been done by the American Heart Association. If you can remember, and some of you may be too young to remember this, there was once upon a time when you could go in the airport or a restaurant and you would have smoking. now that there are no longer smoking in restaurants and hotels and airports, that's due to the work of the American Heart Association. So we really look at the health of all Americans. And when you're talking about where does community sit? There is no health if you're not looking at the impact of those people, the lay people. And that's really where we put up our emphasis. And what I'll say is I have seen this switch, this transition over the last couple of years, where we're really looking at the health of the community, but with the focus on the social determinants of health and what role that plays in it.
So, and I do remember when you could smoke places. So I'm probably aging myself a little bit with that. But I know there's a ton that you're doing in the American Heart Association, and thank you for kind of leading us up to that point. But could you also tell us kind of what led you to here? So from maybe your undergraduate degree to this role now at American Heart Association, what are some of the roles and the things that you've done throughout your journey?
So I will say I kind of fell into this, really fell into it. I started out working, getting my undergrad degree in history because I really was going to be an attorney. So I took the LSAT, and when I took the LSAT, I said I didn't feel like my scores were high enough. And I remember when I received my scores, and I was like, I'm going to wait a year, and I am going to do some community work. So I started working for Save the Children, and from Save the Children, I went to work for the Center for Intergenerational Learning in Philadelphia for Temple University. And from there, I fell into my real passion, which is working with American Diabetes Association. And from there, I held a national position for about 7 or 8 years. And I developed the African American programming nationwide. And I also developed their programs for older adults nationwide. And from there, I moved to the American Heart Association, and I covered there. I started with multicultural initiatives and then moved into this role.
It's interesting the way our life works, right? You start out as history, you think you're going to be a lawyer, and look at you and where you are, not completely different. I mean, some of the work that you're doing is around advocacy, and at its root, being in the legal field is advocacy. So it is a natural progression, but maybe not the way that we might think. And I think that's one of the great things about our speaker series and getting to talk to people is seeing that that path isn't always as naturally as we would think. You might think for someone in your role, you would have a public health background or an interest in experience in that way, but coming with a history degree. What do you think are some of the ways that those previous roles prepared you for the role that you have now?
I will say I work with a lot of MPHs. I work with a lot of marketing. I work with a lot of people. And I will say what prepared me is really being open and willing to learn and trying different pieces. So I would say the bulk of my learning and the foundation of my learning really came from the Center for Intergenerational Learning, because that's where I learned the basics and compliance, which is important. Really, you can't do a nonprofit program if you don't understand the compliance around those programming. I would also say that the American Diabetes Association was instrumental because I got an opportunity to develop programming. I got an opportunity to serve as a national consultant working with 26 states. So you get to see what works in various states, and what you would do in Philadelphia is not at all what you would do in rural South Carolina. It's not what you would necessarily do in New York. So understanding the nuances of each community and each market, and who may be a natural leader in one market may not be that leader in the next market. And so I think the American Diabetes Association kind of gave me that understanding of community. And then I was able to take that to heart and do some, hopefully meaningful, impactful work.
Yeah, it's funny you mentioned that national local perspective. I was just having a meeting with another one of our interns and talking about the benefit of really understanding the local dynamics that go into national programming. That I know that from my own experience, that when you're trying to do national work, if you don't listen and kind of have your foot to the ground and your ear to the ground of what people are saying in those local communities, you're never going to be effective with creating national change. And so it's great to kind of have you validate my point, but also emphasize it. When you think about, you said that American Diabetes Association was where your passion lies. Was there a personal interest of yours in health and in disparities of health and access to health? Because the last, maybe decade has been more centered on that aspect of the work that you're doing.
I would say absolutely, because if you look at, I think heart disease, high blood pressure, diabetes, kidney failure, they're married. They're all cousins and or married. And you really can't do one without doing the other. And if you look at health disparities across the diseases and the disease states, there's a theme that runs through all of them. And so I'd say my passion starts because I think that's where I learned about the disparities and what they look like. And a perfect example of that would be if you're getting an amputation because of, let's just say, diabetes. And if you're getting an amputation, you're more likely to get an amputation if you are a person of color. And so if you're looking at high blood pressure, which is what we really focus on at the American Heart Association, African Americans have the highest prevalence of high blood pressure in the world. Why is that? And what does that look like? So I think understanding those nuances when you go and talk with people are extremely important. And I think that's where the passion is.
I want to make sure I give a chance to the others that are here to ask you any questions before I keep going on. If you are in the audience and you have a question, feel free to type it in the chat and I'll try to moderate it for you. Mike, Shamika, Carly, looks like Genevieve is coming back. She got kicked off. But do you all have any questions that you'd like to ask Ernestine directly? Go ahead, Carly.
Hi, thank you for joining us today. I just was wondering, since you were geared initially towards law school, you probably thrive in structure. How did you transition into, I guess, making that like a lateral move as far as being structured in your position right now? What helped you pull all the pieces together and be, I guess, as organized as you are and a leader the way that you are?
I would say law history provided my interest. I think I'm the same person, and that structural piece is so important in the work that I do. You can't develop a program for millions of people if you don't have a sense of structure and have a framework for the work that you want to do. It may not be a law structure, but you certainly have to have a structure in place and discipline and be able to develop and go back and research. All of that's extremely important. I would also say that you can't do a program without compliance. You have funders that you actually are responsible to and for, and you can't take their money and not be responsible for the work that you do and the deliverables in which you are expected. So I think all of those things loaned itself to me to being successful in the work that I'm currently doing.
Thank you. That was deliverables. Excellent. Thank you very much.
Go ahead, Mike.
Yeah, thank you for being here. It's really, really helpful. I'm going into a field where community involvement is critical. And I was just wondering what's the best way to integrate like parents and schools and communities to come together to work on a particular issue like substance abuse?
I will tell you what I know. We're doing a lot of talk at the American Heart Association today and probably over the last 6 to 9 months. And it's this whole piece about not being in the community, right? But being of the community. And I think our CEO says it best. I think the days are long gone where you develop a program, you plop that program in the center of a community that you feel needs it, and you walk away and you come back and you do an evaluation. Those days are so gone. It is so important and I wish I had taped this for you, so important to know the community, know who you're developing your programs for and what you're trying to do, but more importantly, being of that community in a way that makes sense so that your program is not another program that you're doing for people, but is a program that you're doing with people. And I would say that the American Heart Association is talking about it now, but we have been headed that way for the last few years because those days are so long, they're gone, they're passé, where you're developing this paper and you're researching it and then you're just kind of providing it for people. So my advice to you would be to learn the community in which you want to be involved. Make sure that you have leaders from that community that share with you what they need, and then integrate yourself and with coalitions and people that can help you.
Great. Thank you.
Sure.
Thank you.
That's such a great point, Ernestine. We talk about at SISG this idea of sustainability. And I think for a long time, organizations have plopped their program in and walked away, and the funding dries up and the people are not necessarily invested. And so having that buy-in from the start, having that you're not just creating what the funder said, that you're not just creating what you created outcomes around, but that people are actually saying, we need these services, we have this problem, and you look at it from multiple perspectives. That's how, when you leave and you walk away, the program continues, the services continue, or the impact continues. And so I'm glad to hear that American Heart Association is understanding that, but also to see that it is a trend, I think, not just in your organization, but across the work that's happening in the social sector. I think it's something that our students here who are MSW students learn from a community organizing aspect, that you can't go in and try and organize without having stakeholders and individuals who are really passionate about the work that you're doing and want to see the change in that way. And it's great to see that more organizations are incorporating that.
And the other thing,
go ahead.
Add, I'm sorry, is that really looking at not just listening to the community, but also realizing that you may play various roles. Because you may have this wonderful program, they may have other programs. You may not be the lead always. You may have to be a convener. You may have to be a part of for a while, but just knowing that you don't have all the answers. And a lot of communities, particularly communities of color, are savvy. So just coming in and understanding the nuances and understanding that they know what's best for them. They may not have the resources to do it, but it doesn't mean they don't have the knowledge.
Right. That makes sense.
Yeah.
That savvy point is true. There's a lot of times they've been doing it. They just haven't called it the fancy name that we've called it
exactly.
with the funding. You know, the change making dictionary hasn't defined what the grandmother who's done the neighborhood mentoring for years. She didn't call it mentoring, but she's been supporting young people in that way. So I think that's such a good point. Genevieve, I think you had some questions. Can you hear us and can we hear you?
I can hear you. Can you hear me okay?
We can.
Okay. So a lot of this webinar cut out. So if I'm asking something that was already covered, just let me know and I will go back and watch the recording. But I'm just very impressed by your career and sort of how you started and developing programs. And I'm kind of curious how you started and who helped you and who you connected with, and like, how did you just start developing programs? What was your experience to help you with that?
I wish I could say like there was a magic bullet and there was like this one amazing person. I really wish I could say that. I would say there were a lot of amazing people that are far smarter than me and truly, truly gifted people. And one of the things I will say is, and I tell people this today, like I say this to my team and I truly mean it, and I'm humbled by it. I should never, ever, ever be the smartest person in a room. If I am, that room is way too small because there are so many gifted, smart people that you need around you to really kind of help you level set. What I'm saying is I understand what I bring and I hope I have some worth, but there are other people that have talents and expertise that I don't. And that's what led me to program development. I worked with people that were smarter than me. I got an opportunity to see some of their work. And then I said, I think I can do this. And then it came from there. And after taking a few courses, I was able to do it. But I will say in that practice, please don't believe that the first thing I developed was excellent and it went out and it was amazing, because it was not. And I still see it to this very day. And it probably still haunts me to this very day. But it was really trial and error. And one of the things that I'd say I pride myself on is learning. So I never developed any material that I did not go out and test myself. So I never would ask anyone to test my own product, because if I can't do it and I developed it, certainly someone else can't do it. And then I would test it, tweak it, and then I would give it to someone else to test and tweak. That keeps you pretty honest.
Absolutely. That point about being open to learning, we do a supervision around failure, and that opportunity that it creates when you fail and you don't do as well as you expected. And I think as you journey through your career, there's always those moments where you realize, oh, I could have done that a little bit better, but you learn. And that's a great opportunity to build from that and grow from that. Are there any other questions that you all had from Ernestine before I jump back into some of mine? Genevieve, did you want to build on that? Oh, go ahead, Shamika.
I just have a question with your high blood pressure campaign. It's really successful.
Nope.
Oh, wow.
She jumped off for a second.
Okay.
Maybe she'll come back and cut her off right mid-sentence. Something about the high blood. Try again, Shamika. Let's see if we can hear you.
Can you hear me now?
Yeah.
We can.
Okay. So it's been a very successful program. And so I was wondering what strategies did you guys use to be able to reach a seemingly sometimes hard population to reach? And how did you get them in to get the services that the program offered?
Sure. I wish I could say it was something I developed. It is not. It is something that I implement. It is called our Target BP program, and it is a nationwide program sponsored by the American Heart Association. So I encourage all of you after this to take a look and go to targetbp.org and go to our website, pull it up. It's a fantastic program. How it has been implemented is really looking at, again, the community at large, but then honing our focus in on those clinics where people that need the help most go. So it's a multifaceted approach. So we work with hospital systems, their outpatient portion, but then we also spend a tremendous amount of time looking at those federally qualified health centers and working with them. And it is a systems approach to this program, meaning when I go to an FQHC, I'm really looking at how do I work with that chief medical officer or that quality person to get them to adopt our blood pressure algorithm, because the goals are huge. If blood pressure is has the highest prevalence in African Americans in the world, think about that. That one-to-one approach is never going to move the needle. It really has to be a systems approach, and it has to be a sustainable systems approach. So in that, we work with FQHCs, and we also work with hospital systems.
Thank you.
Sure.
Okay, go ahead, Mike.
Okay, so I would probably not ask this question had I not been a part of the SysG group. We are doing a lot of work with social media, and I am just curious what your perspective is on how social media has affected the social work profession.
I can't speak to the social work, but I can say this. Everybody is on some form of social media. From Facebook, and I'm not tech savvy, to Twitter, okay, to Instagram, to it all. We actually have dedicated in this affiliate, which covers those 5 states that I talked about, we have a social media digital person. Her only job is to put our messages out in social media. That should tell you the depth and the breadth of our work and how we realize the importance of having our messages out through social media. It's a major platform for us.
Right. That makes sense.
It's funny you mentioned that, Ernestine. We do a training on introduction to social media and awareness through our training work. And we try to find different platforms and examples of organizations that are doing great work on each of those platforms. And we've used American Heart Association for Periscope because you're one of the few organizations that are on Periscope, and you have some really great resources. So it's definitely, you can see the benefit of it. And I think your point about wanting to really systematically change the way people look at their health related to heart disease and blood pressure and those types of things does require kind of that big footprint. And it's easier to do some of those things through social media platforms. I do want to remind those of you that are in the audience, you can type questions if you have any, and I'll moderate them. Those of you that are in the call, any other questions before one last time? Okay, so tell me a little bit about that question that doesn't make sense, but the typical day, the typical week, or the typical month. You can pick whichever metric you'd like, but what is typical in the role that you have?
I would say the most typical in the role that I have that is ever changing every day, right? So one day, like Monday, was conference calls and meetings and I'm not exaggerating, from 9 o'clock till 5 o'clock. And if you have meetings from 9 to 5, you do your work from 7 to 10, right? So because you have work to do after the meetings. A lot of times it's going from market to market because you do travel and you have staff and you want to catch up with your team and you want to learn, and it's team meetings. And so you have cross collaboration team meetings, you have team meetings, you have your one-to-one meetings. So I would say, and then you want to get out. I do, and I want to see the work. So some of my day, I try at least once a month to spend some time in the field with colleagues, just so I could see and experience and not forget and learn. So I think it varies from day to day, but I'd say the bulk of the work is meetings. And the second part of the work is really trying to just be out there and be, of course, in the community and learning the pulse and keeping your finger on the pulse.
Yeah, I can definitely relate to the 9 to 5 meetings, trying to figure out how do I actually get work done when I'm in meetings all day.
All day.
You have some staff responsibilities in this role, and you've had those in some previous roles. What do you think is your leadership style when managing staff, and how did you learn that? How did you figure out what was best for managing, or do you change it for managing the team that you have?
Oh gosh, I think that's a question you should ask the team, and I'd be curious to hear that. I would say I am really fortunately or unfortunately, a numbers-driven person. So I'm very metrics, very goal-oriented, but I will say that style does not work for everybody. So I like to know where we have to go for the year and break that down and talk about that. That may work for person one, but that style may not work for person 2 and 3. So figuring out how to ebb and flow within the team while also getting those things done. And I'm learning. And I will also say, when you are working with the younger generation, they don't want to have a meeting that's longer than 30 minutes. I had a millennial on my team and everybody scheduled an hour, 45 minutes to an hour. I was surprised if I could get 30 minutes out of her. She would tell me what she wanted to tell me. She'd come in and that was it. So it's learning everybody's style and learning what works best for them, because it's not about me at the end of the day, right? It's about working with other people.
Yeah, that having to maneuver around things. I actually would lean towards that. I'm not a huge fan of meetings, and I'm very much about they have to be focused on what you're meeting for. But learning their style definitely is a core part of that. What other skills do you think someone needs to work in your position? What are some of the strengths that they must have, or the things they must learn in order to be successful?
I'd say strategic planning. I'd say program development, implementation is key, but not just program development for program development's sake, and not having it pie in the sky, but having it where it's tangible and it's implementable in the areas in which you are. Localizing it is extremely important. I've seen many great programs not make it off a shelf or not just fall flat because there's no implementation elements to it, or it's just too difficult. Understanding the community is important, being a community organizer. So if I had to say there was a few skills, I would say strategic development, strategic planning is super important. Being able to collaborate is vital, because in these days with less and less resources, if you can't collaborate, it's not going to work. Not only that, if you're applying for grants, they want to know who you're collaborating with. So if you're not a collaborator, this business is not for you. And being able to measure success. And that's another piece. So it's not just metrics for metrics' sake, but it's also being able to measure the success that you've had and tell that story in a way that a funder would want to hear it.
Yeah, that collaboration piece is so important. And it's one of our pillars. And I think too often people think that, oh, I have a really great idea, so I can just move that forward, and you're never going to get anywhere if you don't work with others. Were there any other questions before Genevieve said some of it cut out. So could you say your last point was collaboration? Did you get that? Go ahead and talk, Genevieve.
Yes, I got collaboration, and then it cut out for the last one that you mentioned.
So I mentioned program development, strategic planning, collaboration, and measuring your success.
Yeah. Okay, thank you.
Kind of on that, in a way, that piece about collaboration, but also for many of our interns, they're career changers. So they're in graduate school now because they've been in a previous career. Some of them are military and coming to civilian service. Some are just coming from corporate, wanting to go into the social sector, or vice versa, and wanting to really be able to make a case for their experience and their knowledge, but maybe outside of what an employer is specifically looking for. If they're looking for a position in your space, what are some of the things that you look for in people who are coming to your organization, or to work on your team, or to work on the things that you're doing at the American Heart Association?
I'll say two things. The American Heart Association, particularly this affiliate, we are committed to just the things that you said, right? So we are committed to veterans coming back and working. We have a person that is dedicated and looking for just that group of people and how they plug in, because those skills that you learn in the military, oftentimes they're transferable. And so I encourage each of you to take a look at heart.org, go to our website, because there are opportunities. And I can tell you, for this affiliate, we are really committed to that. I would also say being able to tell your story and being able to make those connections, right? So if you're going for a job in the community, have the ability to talk about the work that you've done and how some of those skills are transferable into the work that you're applying for. So if you have done planning in the military, then you can do planning at AHA. It's just the way that you tell that story. If you have done coalition building, or if you convene volunteers and you've done volunteer management, again, it's just the way that you tell that story. But I will say that the American Heart Association is truly, truly dedicated to working with people of color, but more importantly, also working with veterans.
Are there any things that you can think about within your journey where you were able to advocate for your experience, even though maybe on paper you didn't seem like the natural fit for that role? Like, you have a history degree, maybe your experience doesn't align. How did you make that case? Like, how did you, I know you you mentioned like telling your story and talking about those transitions, but can you think of ways that you in your own career make a case for yourself for maybe roles that you weren't maybe on paper the person that they would think of?
Sure, that's my last role, right? So
Okay.
on paper, I was not qualified. My work at the American Diabetes Association was in African Americans and older adults. Now, if you ask me to do some work in that space, that comes off very easily. I've done it quite a few years. But when they had this position open the first time, I applied for it. And the SVP at the time said no. She told me, no, I didn't have the qualifications for it. And what I did is I worked harder. We made our goals every year. We exceeded our goals. We were number 1 and 2 in the country. And then I reapplied with the whole premise of, I've done this. I think we've proven ourselves. Give me an opportunity. But I would say I was told no when this position first came open. So I would say, A, don't give up. Number 2, I wouldn't ask for something if I haven't done the thing that I am being asked to the best of my ability. Excellence, excellence, excellence. And from that, you can position yourself and parlay yourself, I think, to advocate for other things.
I like the idea of going back and like using that as a motivator to learn those skills, to get that experience. Instead of, I think too often people are like, I didn't get the job, so let me just find something else. Instead of saying, yes, this is the work and the things that I want to do. I'm going to show you how qualified I am, or I'm going to build on that experience and grow in that experience to be more qualified the next time. Your career is a path. And I think too often we get really focused on this one stop instead of thinking, hey, maybe today isn't the day that I have this role, but I can do this work in a different way if I just keep working at it and working at building my skills and my knowledge. So thanks for sharing that. Anyone else have a question before I continue on? Genevieve, did you have a question? No. Okay. Carly's asking, how did you know this role was 100% for you? This current role?
Because it married my interest. So it married, I'd been looking at the world through the lens of multicultural health disparities. And I wanted to take that and expand upon it. And you also don't want to put yourself in a hole, right? You don't want to paint this picture and people think that's the only picture you can paint. So I was really open to expanding my skills, but I knew that if I could do one, I could do the other. And I felt like they were really a marriage, because I can't work in a community for multiculturals and not understand the nuances of the community at large. And so I feel like I was able to bring that to this role.
To kind of build on that, when you've been at other positions, I know, like you said, you were at American Diabetes Association for almost 8 years. When did you know that it was time to start looking for that next opportunity? What in your role or in your position helped you to figure that out? We have some interns who have been in a particular field and they can grow in it by getting this degree, but maybe they should look for something else. How did you know, even though I've been there and there's opportunities to grow, it's time to maybe think of going into a different space?
I had my pastor say that the day that he gets up to give a sermon and he doesn't get a little bit of nerves is the day to quit, right? Because you've kind of lost whatever that thing is. And I don't want to say that I lost it, but I wasn't getting as nervous, right? And I was taking things for granted that I probably shouldn't. Not that I did a bad job, but I wasn't getting the nerves and I wasn't getting the excitement, which means that there's somebody better that could do it, that would bring a perspective and that would have a fresh lens to it. And so I think that was it for me.
That is such a good thought, because I reflect on that. Like even my role now, there's still new clients or new work and I get a little nervous. I get a little like, are we going to do the best that we can? Or if it's a training, are we saying the best or sharing the best information? And I can think about in past jobs where that point left. It was, okay, I know what to do. I know what to expect it. I know how this is going to turn out. Even the things that I know aren't going to go well, I knew what wasn't going to go well. I could see it coming down the pipeline, and it became very monotonous and mundane. And that idea that the nervousness that is common in positions, even if it is the same task, but that uncertainty is a good measure of whether or not you should succeed or continue in that role. That's a great great way to think about it. Anyone else have a question? You kind of talked about this a little bit, Ernestine, when you were saying why you were passionate about this work, but how do you feel your work makes a difference in your specific role at American Heart Association? How does it make a difference for social good?
When you think about, I live in Philadelphia. So when you think about there are 1.5 million people in Philadelphia, there are 43% of those people are African American. About 14% of them are Hispanic. And if you think about just the social ills of that, if you think about, we do this work around life expectancy. And if you think about just in North Philadelphia, which is considered a high-risk population and poor, and all the social determinants of health that you can imagine exist in North Philadelphia. And then if you think about where I work, which is in the city, and the life expectancy is about 20 to 25-year difference, and I could probably drive there in 10 minutes, right? And if I can drive there in 10 minutes, and it's a 20 to 25-year life expectancy, depending on where you're going in North Philadelphia and where you're going in the city, then there's a lot of work that needs to be done. And then if you think about food access as just one factor, there's so much work that needs to be done. And how can we not feel like our work is impactful, even if we see that number go down from 20 to 19 or 25 to 23, then we've made some impact in that community. And I just feel like and you can go across GRA, you can go, I'm in Columbus today, and you can go to Delaware, but if you go to any of these cities and you see the same thing, the numbers may not be as great, then we have a lot of work to do. So I know that the work that we are doing is impactful.
Yeah. I've never heard that statistic of the life expectancy in that way. That is sad. That is super sad. And there's so much, like you said, so much work to be done. Do you think that in your role in a day-to-day space that you're also helping those that work with you to better understand this work, like your leadership? Are you mentoring, and in what ways do you try to mentor those that work with you?
I do. And I think, every person is different, right? And everybody's motivated differently. But I will say I have a unique opportunity because we have what we call generalists, which are our community health directors, and they're looking at the community from the big. And I get this awesome opportunity to question, how are we making sure that the work that we do hit the communities that need it most? So a perfect example is we have this priority, or we used to, call shared use. And what shared use means is if you live in a community and that community has a school, and if that community has a school, can you use that school gym or grounds for physical activity? Because a lot of places, there aren't places for physical activity and for children to run and play. That's great. But a board member's school who lives in a rich neighborhood and I open it up, yes, we have shared use, but have we had shared use to those that need it most? So I get an opportunity to say and question, okay, guys, this is wonderful, but are we making sure that this hits the people that need it most? And I get a chance to talk about health equity and health equality. and reminding our team that there's a difference between health equity and equality. And so I do feel, for the most part, because of my background, that it lends itself to really sharing. And not everybody takes it the same way, but really being able to share and open people's eyes to that.
That example with the shared juice is so important, because I think sometimes people are too busy counting up like outputs, like, oh, we were there, we did this there, and not really like, were those the people that needed it? Were those the people who could benefit, or that we're actually trying to create the change for? Counting doesn't change that. You mentioned this difference between health equity and health equality. Could you give us your lens on what that is? What's the difference between the two?
Sure. When you're looking at, and I'll send you the slide, right? When you're looking at health equity, you're thinking, health equality, you're thinking, you know what? Everybody should get the exact same thing. Everybody should. And the thing is, I think the analogy in the picture I have is some kids are at a baseball game and they're looking at the game, and there's a fence, and there's, kids of different heights. And so we give everybody a stool so that they can see the game. Have you guys seen that one?
Mm-hmm.
Well, that's not it. I'm 5'1". I might need 2 stools, right? So that I can see the game. And understanding that everybody doesn't need the same thing. Some people, if you want to have equality, some people may need 2 stools. Some people may need 1. Somebody may not need one at all. And that's okay. But you're making sure that you address the people that need it most.
That's great. Yeah, I've seen that meme or like going through social media, and they have like 1 box or 2 boxes, but the person who's more in our height range, the lower ends of the 5, he's still kind of looking at the fence, 1 stool. So I definitely get that. Yeah. Anybody who's on the call, any last questions before I ask our final question of the day? All right. So what is one piece of advice you would give someone who wanted to work in this position or in this role or in this field?
I gave this advice to my niece, and she has her master's, and she is this gorgeous young lady, super smart, transitioning. She was a farm rep, and then she transitioned into this role. And I gave her this advice, and the advice is, do not be afraid to get your foot in the door by starting small, right? Just because you have a master's doesn't mean that you're going to come out and get a master's level job. It means that you have an entry point to get into that company. And do not be afraid to come in and work and get your foot in the door. And a perfect example is I'm hiring an admin, and my admin has her bachelor's in community health, but she doesn't have the skills to be a director, but she's willing to come in to be an admin, to learn, to get to where she needs to be. And I think sometimes we become too prideful to realize that everybody has to start somewhere, and that somewhere may not be where you want it to be today, but it doesn't mean that that's where it's going to end. And that would be my advice to anybody.
That is so important, because a lot of companies hire from within first. And if you're already in, you'll get access to training, you have in-depth knowledge, and people don't realize how much, particularly in admin roles, you see really the inner workings of the organization, more so than sometimes the program staff or especially the leadership. And so sometimes coming in as an assistant, coming in at an associate level, and staying there for a year, getting an understanding of the company, and then applying for what would have been what you thought your next step can be a huge opportunity in that way. Okay. There's one other question from the audience about AHA programs that are doing great work and wanting to get involved and volunteering. Where can they go? What can they do to find opportunities to be involved in their local communities?
I will say, and I asked our HR person before this started, go to heart.org. Go to heart.org and plug in your community and you will be amazed at the opportunities that we have readily available, from positions to internships. You have a great internship with the NARA, to, oh my God, volunteer opportunities. So I would say if you're interested, go to heart.org.
Right. Well, thank you so much, Ernestine, for sharing your career journey. And it's great to see and hear about the work that you've done up until this point. Thanks for giving a little bit of time from your afternoon. We'll have the recording and the replay for people who have questions. They can email and we'll get those questions to Ernestine. Thanks, everyone. Have a great afternoon.
Thank you. Bye-bye.
Thank you.